Now on, we'll be actually learning what is cosmetology. Cosmetology, by the word, says cosmet and ology, means study of beauty, face and hair. What it will all include? Understand the fact. It is cosmetology, it is aesthetics. We'll all be talking about how do we perceive beauty, how do we enhance beauty, and what are the steps we will need to remember during our procedures to be needed. Everything will be covered henceforth. What we'll be learning here now is what basically is cosmetology, why there is a need of this science, and furthermore, we will classify what are the branches of cosmetology. Let us go ahead. Here, what is cosmetology? Cosmetology is the basic science of beautifying your face, skin and hair. By definition, it is a branch of science which deals to improve the appearance of a patient's face. He might visit you for a specific need or for enhancements. They are usually invasive or non-invasive procedures which will work on the patient. It depends on massive experience of what you do to your patient's skin, your patient's hair, or on a beauty in general. Let us now understand why there is a need of this science. Understand faster aging. Nowadays, we are into a lifestyle which is a very fast-paced one. These fast-pacing lifestyles require more of dedication, more of work, and nowadays we are all working with screen times. Either we are working on our mobile phones or we are working on our laptops for specific learnings, may it be work related or may it be enhancement related. So this, what happens is changing our lifestyle. We definitely, as patients, do not sleep on time, do not wake up on time, and normally the stress level has increased. So because of these following factors, we do see faster aging which is happening. Coming to our second point, which is photo damage. We are all aware that we have huge holes in our ozone layers. That is why the UV index of the sun rays coming inside planet Earth has increased. Because of this increase in the UV concentration of the sunlight coming into has given rise to photo damages. Understand the word photo damage, damage because of the light source. Coming to your third point, pigmentation. What will happen when you are into photo damages? Definitely the skin gets burned. This burning of the skin gives rise to spots of pigmentations or some of the diseases of the skin which are related to increase in pigment production of the skin. Symmetry. I will definitely divide symmetry into congenital, which is from birth, or it is acquired. There may be some circumstances where patient unfortunately meets with an accident where his symmetry is taken care of. It is hampered. We will have to step into this process where we enhance or bring back the symmetry to the normal things. Also taking a part of your congenital aspects. These congenital aspects may be from birth. Example giving you may come across with cleft lips, you may come across with cleft palates, you may come across with retrographic mandible, where the mandible is born short. In these kind of cases, not only non-invasive procedures, but invasive procedures to improve the symmetry of the patient has also been taken care of. Stress-related skin and hair conditions. You are very well aware that hair loss conditions are increasing day by day due to these all environmental factors coming together. This will induce the hair which the patient is growing, or he or she may come across hair fall issues. We'll have to take care of that as well. Skin conditions, as I told you. Stress, here you all be knowing, increases the cortisol content in our blood. And cortisol, being a degradative hormone or an enzyme in the body, induces faster aging again. Hormone control, you are very well aware again. Patients are going into hormonal imbalances because of the lifestyle which they have. You might know also very females are going through conditions of PCOD, PCOS. People are having psoriatic lesions. These are all bound to be hormone related. Developmental or acquired anomalies. These anomalies can be superficial, anomalies can be congenital, they can also be developed over a period of time. These all, and finally, near golden ratio. Everything in a patient is perfect. They are in a state of well-being, but still they want some kind of enhancements from the natural form. These natural form which requires enhancement has to be rigorously studied, and to a very expected limitation can be taken care of. Very, very important. The final part is want versus a need. Patients will come to you with unreasonable and unrealistic expectations. Here, we become the judge of what the patient really wants and what the patient needs. These are two different approaches we'll have to take care of. Now, according to based on these theories, what is happening and the need of this science, let us come and classify the branches of cosmetology. First, I give you what is known as medical cosmetology. Understand a fact. Here, the patient will come to you and give you a set of procedures or a set of ailments that the patient is facing. He'll come up with a disease or he'll come up with a condition. You will be formulating a proper treatment plan for it, execution of the treatment plan, and giving the patient the desired results. That here is known as medical cosmetology. On the other hand, I come to commercial cosmetology. There may be patients coming to you who require or want a specific kind of a treatment. Everybody now is a huge fan of social media, so that everybody is aware of aesthetic procedures going on. Somebody might come up to you and tell you that, sir or madam, I need carbon facial today, or I just need hydra facial today. So here what you actually do is do the set of treatments or procedures for the patient, charge whatever your regular charges are, and the patient walks home. Second condition, what can arrive? Nowadays, because of work, patients tend to travel a lot from city to city, from country to country, all over the globe. Because of that, if the patient is undergoing a treatment with one of your aestheticians, he might require continuation of this treatment. If he is wanting that continuation, he will approach an aesthetician like you and he will describe, I am already going through a treatment at so and so place, but I want a continuation here. So you will ask the patient what treatment actually you are going on and what was the treatment plan given to you by an experienced aesthetician. Once that happens, you step in at the stage where this treatment is taken forward. You do that treatment, get an informed consent from a patient and conduct the procedure. After the procedure finishes, you end it up, charge your bill and the patient goes home. This is known as your commercial cosmetology. So what we learned here now? We learned about what is cosmetology, what are we dealing with, why there is a need of this science, and how do we classify cosmetology.